Okay, I think we're going to get started. Hello, everyone. Welcome to today's seminar, and thank you so much for joining us. My name is Linda Garcia, and I'll be your moderator for today. Je parle aussi français, alors s'il y a des questions en français, n'hésitez pas. I am a professor emeritus with the University of Ottawa, the Interdisciplinary School of Health Sciences, and I have the great pleasure to work with Annie Robitaille and with Ali Chiarelli, who is our speaker for today. Today's presentation is entitled Dementia, Daring to Travel Across Canada, Out of Care and Into Life. Following today's presentation, there'll be some time for questions. You can ask your questions by writing them in the Q&A box at the bottom of your screen, and we will do our best to get through all of your questions. We also ask that you take a minute at the end of the webinar to complete a short survey that will appear on your screen when you exit the webinar. Today's webinar will be recorded and will be made available shortly after on the Pearly Health Center of Excellence website. So it's my pleasure to introduce Ali Chiarelli. Ali completed her Master's of Science in Aging and Health through Queen's University. Throughout her master's degree, she gained experience working with older adults in both institutional and community settings. Her desire to continue supporting older adults in the community led her to pursue her doctoral studies and join the Life Research Institute. She's currently a first-year doctoral student in the Population Health Program at the University of Ottawa. Ali aims to contribute to the development of age-inclusive communities and raise awareness for the needs of older adults, specifically people living with dementia and their care partners. I'm thrilled to be part of Ali's team working on this very exciting project, and I can't wait for her to tell you all about it. So over to you, Ali.
Thank you so much, Linda, for the introduction, and a big thanks to Pearly for giving us a chance to share our research. I'm super excited to update everyone on the progress so far. I wanted to kickstart the webinar by giving a shout out to the amazing team that I've had the pleasure of working with on this research. Special thanks to Linda Garcia and Dr. Annie Robitaille, my doctoral supervisors, as well as Dr. Michael Mulvey and Valentina Promosi, a PhD candidate, and they're both from the Telfer School of Management at the University of Ottawa. And it's been such a privilege to work with them using different disciplines for this project. The initiatives that I will share with you today stem from the following knowledge. We acknowledge that travel contributes positively to the quality of life and helps reduce social isolation, especially among older populations. We also recognize a shift from business to leisure air travel, which often involves passengers traveling with their family or companions. We understand the increasing prevalence of dementia in our aging population and the importance of maintaining travel opportunities for these individuals. We also emphasize the need to address non-visible functional limitations and the fact that, unfortunately, they're often overlooked or misunderstood in the air travel sector. We recognize Canada's commitment to becoming barrier-free by 2040 through the Accessible Canada Act, and we acknowledge the complex cross-jurisdictional nature of air travel and the significance of collaboration across various sectors. Knowing and recognizing these facts, our group is really interested in knowing how the air travel industry can improve accessibility for passengers living with dementia and their travel companions. This is our attempt to take dementia out of care and back into life. We've also been monitoring news headlines, as I'm sure most of us do. News headlines from around the world are demonstrating that travel issues related to disabilities extend beyond particular regions and specific diagnoses. For us, this really underscores the importance of travel policies and practices that advocate for inclusive and more equitable travel experiences for everyone. And this further emphasizes the need for a global and harmonized approach. We are certainly not alone in this endeavor. Initially, Air Canada had reached out to us to address this issue of dementia in air travel. And in exploring this question with others, we discovered the global nature of the issue, with initiatives and efforts already underway in various cities and academic institutions in the United States, in Australia, and a very strong group at the University of Plymouth in the United Kingdom. And this is how the I Dare team, a global coalition dedicated to this cause, was developed. Shortly afterwards, Transport Canada reached out to us, and this really got the ball rolling. With their support, we knew that we could create an integrated interdisciplinary team that had the ability to make Canada a player at the table. Emphasizing this need, we assembled an interdisciplinary team, including experts in marketing, consumer experience, health sciences, law, medicine, political science, and engineering, and without excluding advocates, people living with dementia, and of course, people from the air travel industry. We explored what was already being done through literature reviews and online discussions, and we consulted with Canadian and international stakeholders and provided some preliminary recommendations. Netnography refers to the qualitative research method that analyzes social phenomena within online communities. And so our team used netnography to explore online discussions on the platforms listed on the slide using specific keywords that were related to air travel and dementia. And it was really interesting to acknowledge the online conversations and discussions, mainly focusing on seeking information regarding accessible services for people living with dementia. And this really highlighted how many people were seeking support regarding inclusive air travel through discussions online and, quite frankly, from strangers. We are also very proud of the group of stakeholders we were able to bring together during the first phase of this project with the support of Transport Canada. And so this group met several times over several months to discuss issues of relevance specifically to Canada. And our consultants included airlines, including Air Canada and WestJet. We included airports like the Montreal, Toronto, and Vancouver airports, as well as persons living with dementia and advocates, and of course, regulators like the Canadian Air Transport Security Authority, the Canadian Border Services Agency, and the International Air Transport Association. This group was able to identify key areas for improvement, including information and awareness, disclosure and identification, spaces and accommodations, formal training, and standardization of processes. For all of these, all of the stakeholders came to the realization that a person-centered approach was needed. They all realized that dementia needed to be viewed along a continuum and that the whole person, rather than just their health condition, needed to be considered. In other words, solutions needed to be diverse and tailored to people's needs. The focus was really on making changes, increasing awareness, rethinking disclosure, and providing reasonable accommodations. These are crucial for improving the travel experiences for individuals living with dementia and their travel companions. Some key messages from the group were that we recognize the importance of involving users and their travel companions in the decision-making processes. So what does this population need to know, and how can this information be made available to them? The group also questioned the necessity of disclosing the diagnosis and the importance for the industry to know what these passengers really needed. Most importantly, the group underlined the importance of collaboration. They stressed the need for universal collaboration and standardization, encompassing people with both visible and non-visible disabilities. And this really helped to inform the next phase of our work. We then went ahead and conducted a website content analysis with the goal of identifying existing and proposed services and programs available across Canadian airport websites for passengers with disabilities, but with a specific focus on passengers living with dementia. We conducted the analysis with a sample of 30 Canadian airport websites that were selected based off a list provided to us by World Data Info. We initiated by examining 10 airport websites using the 5 areas that we identified in the previous phase of our work. And then we developed 26 codes for the analysis of the remaining airport websites. Finally, we interpreted the results and developed a final report. We found that dementia-friendly travel experiences are still a novel topic. Although airports often offer services addressed to people with disabilities, they are not specifically related to people living with dementia. In addition, these initiatives were often sporadic and they did vary from airport to airport. But we did find that transportation services, feedback and complaints, and wheelchair services were among the most frequent offerings. And we do believe that this trend is associated with the mandates from the Canadian government. And although most websites describe the services mainly through writing, we did occasionally encounter some great visuals, which were really beneficial in identifying the services available. And in addition, the visuals already gave a sense of what to expect as support. And we recognize that it also helped to understand the nature of the services that are offered. There was also a varying use of terminology across the different airport websites, which we thought reflected a lack of standardization in terminology related to accessibility. And this variability can sometimes lead to confusion or inconsistencies in understanding the scope of the available services for individuals living with dementia or living with other disabilities. A question that had stuck with us throughout the analysis of the websites was, do people living with dementia see themselves as having a disability? And individuals living with dementia may not always identify themselves as having a disability, but may view their condition as a cognitive challenge. And so this variation in perception really highlights the importance of clear communication and accessible services at airports to support their unique needs, and to ensure that they have a comfortable travel experience, regardless of how they perceive themselves in relation to disability. So as I mentioned, we did identify 26 codes that represent the services and programs on the Canadian airport websites. Among these, we wanted to emphasize that the most relevant services for people with firsthand experiences of dementia. And we had these aligning with the 5 key areas that we previously identified. The programs and services that I have in red are the ones that we deemed most relevant to travelers living with dementia and their travel companions. The Hidden Disability Sunflower Program is the most applicable service related to travelers with dementia. This is when travelers wear the sunflower. It's a lanyard. You can see the little sunflower on the slide there. It indicates to airport staff that they may require extra assistance throughout the airport. And this program is offered by 160 airports worldwide, and Canada has 8 airports on this list. Escort passes were available on 16 airport websites, and this service allows travelers to obtain an escort pass for a family member, companion, aide, or even an airport staff member to assist them from arrival at the airport to their terminal for departure. They are meant for travelers needing additional support getting through the airport checkpoints, and this service is available to those with physical or invisible disabilities. We found that meet and greet services were available on 7 of the airport websites. And I think it's important to note that some airports use different terminology surrounding this service. So it could also be called an airport tour or a passenger rehearsal program. And this service allows travelers to schedule a tour of the airport before their travel date to help familiarize themselves with the space and the different checkpoints throughout the journey. It's not specifically for travelers with physical or cognitive impairments. However, the program helps to identify airport services and programs and promotes a seamless airport experience for travelers with dementia, whether they're traveling alone or with a travel companion. Unisex, family, or assisted washrooms and change rooms were available on 11 airport websites, providing ample private space for travelers. Interestingly, some airports have accessible washrooms, but in most cases, this referred to wheelchair-friendly stalls within the public male and female washrooms. Assisted washrooms allow travelers with dementia and their travel companions to have a private space that allows them to remain independent through their travels and to help those who may need assistance by someone of the opposite sex. Quiet rooms was an important one, and we identified it on 7 of the airport websites. A quiet room is a separate space where travelers can relax or wait for their departure. And I also wanted to note that these do differ from airport lounges that frequent travelers may access. A quiet room is is open for all travelers and is designed to offer a quiet space that removes them from the hustle and bustle from the airport. It's recommended to use quiet rooms for travelers with dementia and their companions, yet most airports didn't have this option available on their website. Accessibility request forms were also found on 7 airport websites. They are an online form or direct contact information that are available to request accessibility services or ask questions about airport services before travel. At many airports, services must be ordered through the traveler's airline, aside from these 7 websites that we reviewed. This form allows travelers to plan and pre-arrange services that they might need. And interestingly, the form typically focused on physical impairments and didn't mention anything about cognitive impairments or invisible disabilities. Accessibility request forms could be implemented at each Canadian airport, and this would provide a much more seamless travel experience for everybody. And to ensure that we had a comprehensive approach to our work, we wanted to explore whether there were any additional accessibility programs or services that maybe were not found on the websites that could support travelers with invisible disabilities, particularly those living with dementia, which led us to the next phase of our study. In the next phase of the project, we conducted interviews with airport informants to uncover initiatives, both current and upcoming, that might not have been listed on their website. We interviewed 10 airport authorities, and 26 final codes were identified from the interviews, and then we developed 5 themes. The interviews ranged from 50 minutes to 2 hours in length, and we had anywhere from 1 to 2 key informants per interview. Among these airports, 9 of them handled international flights, and 1 was categorized as a regional airport operating within Canada. %80 of the airports were national airport system airports, and this means that they experience an annual traffic of 200,000 passengers or more. And we ended up having a total of 16 key informants from the 10 airports. And informants ranged from experienced managers and directors overseeing terminal operations and regulatory compliance, all the way to operations coordinators and specialists focusing on accessibility, safety, and customer service. And the titles of the roles varied greatly, as did the key informants' backgrounds, which included experience with airlines as well as experience with government agencies. And despite the varying levels of experience, it was clear through the interviews that there was a commitment to continuous learning and adaptability in response to the dynamic aviation system. The experience of these individuals speaks to the challenges that might exist in harmonization of the roles and responsibilities across jurisdictions and across airports, and it definitely highlighted the importance of training. As previously mentioned, we developed 5 themes. So we did identify 4 themes to form the narrative trajectory of the air travel journey. So these include the pre-planning phase, the arrivals phase, check-in and customer service, as well as security and post-security. And then we added a 5th theme, which was system-wide initiatives. And this was to regroup those programs and services that were potentially impactful at any phase of the journey. Our informants shared that many current and planned initiatives that better offer accessibility to persons living with disabilities, but we did choose to report the initiatives that we deemed most relevant to travelers living with dementia and their travel companions. And this was based on previous findings from our previous work, as well as insights shared by persons living with dementia and the current literature on the nature and impact of cognitive disorders. In the upcoming slides, I'll present our findings from the interviews, and each slide will feature some direct quotes from the key informants who contributed to our project. So we begin with the pre-planning phase. Navigating the intricacies of air travel requires thoughtful pre-planning, a crucial phase for individuals living with dementia and their travel companions. This stage of travel highlights the importance of accessibility initiatives that empower passengers to familiarize themselves with the available programs and services before they begin their travel. All 10 airports prioritize information sharing through their websites and have been actively working on improving their websites following mandatory accessibility plan disclosures in 2023. And it was nice to see that some of the airports were even using feedback from their communities to help make these improvements as well. 9 of the airports offer a service request form on their websites. And this is where passengers can add notes, put in their flight details, or any additional information that they wish to share. And these efforts can help passengers living with disabilities. However, some informants suggested that more needs to be done to make travelers aware of this information on their websites. And some even talked about information sharing through social media. One idea that might be to use a pre-departure checklist for travelers living with dementia to identify their potential needs, acknowledging that not all people living with dementia necessarily have the same needs. And then we have our arrivals phase. And the arrivals phase dives into initiatives to enhance the arrivals experience for passengers living with dementia. And it includes a spectrum of programs and services tailored to individuals starting their journey to and from the airport, and extends its offerings to activities upon arrival and check-in. A key element of the arrivals experience is the availability of on-demand services and programs. This core offering allows passengers to request specialized services upon their arrival at the airport and can cater to the specific needs that might arise once they enter the complex environment of an airport. Key informants highlighted the importance of providing these services, recognizing that passengers may only identify their needs once they begin the complex activities at the airport rather than during that pre-planning phase. Designated staff are often positioned throughout the airport, providing immediate options and assistance to arriving passengers. According to the key informants, wheelchair assistance is still the main way for airports to support passengers who need accessibility support, even if they don't really need a wheelchair. For 8 of the airports with these pre-booking options, they also extend their services to on-demand. This gives passengers an option if they aren't able to, let's say, book those services beforehand. And this can involve passengers calling someone for assistance at the curbside or going to the information desk upon arrival. And so curbside assistance was a program that we found was gaining traction at all of the airports. And we found that it was currently available at 7 of the airports that we spoke with. And it offers universally accessible assistance at drop-off and pickup zones, including anything from luggage help, help with your flight details, or check-in support. And while typically an on-demand service, some airports are working to allow you to book in advance, and you can do customized options, which is great. And this service is also very closely linked with our meet and greet initiatives, which also provides tailored assistance, often pre-arranged beforehand for a smoother travel experience. Offering these on-demand services is vital, especially for passengers who may not realize their needs until they arrive at the airport. And key informants stressed that it was very important for them to actively be offering assistance throughout the airport to address these immediate needs. In the context of airports, check-in refers to the process through which passengers confirm their presence on a flight, receive a boarding pass, and often drop off their luggage before proceeding to the departure area. And this step typically occurs at the check-in counters or self-service kiosks that are working to be designed more for accessibility. Information desks were found to be a primary resource for travelers living with dementia and their travel companions. They offer passengers a dedicated space to look for information or additional support about the available services. And this means that training is a key part of knowing how to interact with passengers who might potentially have cognitive challenges. The key informants also discussed the impactful presence of volunteer customer service programs. And these programs really demonstrated a collaborative approach to customer service, and they create a welcoming environment for passengers, especially for those who might appear to be confused. We also found that feedback and complaint processes also play a crucial role in improving passenger experience. Our research highlights how feedback drives the development of services and programs at the airports. And a great example was shared with us from one of the key informants. And so the introduction of an accessible washroom at one of the airports stemmed from feedback from a family coming from outside of Canada. And they needed a space to attend to the toileting and changing needs of a family member, and they found themselves with nowhere to go for privacy. So this prompted the airport to address this concern by creating a non-gender accessible washroom. So I think this response really shows airports' commitment to meeting the needs of diverse populations. We have security and post-security processes, which refers to initiatives both within security procedures themselves and the programs and services available after passengers have completed the security screening. While not all services fell under the responsibility of the airports, our informants were able to share some initiatives that helped streamline the process. As previously highlighted, accessible washrooms and change rooms are very important for travelers with physical disabilities and can also be very beneficial for those living with dementia and their travel companions. These facilities provide a private space with features like automatic doors, emergency alert buttons, and wheelchair accessibility. And they can also offer gender-neutral areas, allowing for any companion to help regardless of gender. And community engagement and partnerships were also very much highlighted in the interviews, because we learned that 4 of the airports have partnered with Changing Places, which is an organization that specializes in promoting accessible and inclusive washroom facilities for individuals with specific needs. And so I shared a little photo of kind of the format of what a Changing Places restroom would look like. So it's even inclusive of an adult changing table. And the process of going through security was further highlighted for people living with dementia and their travel companions. 3 of the airports offer an express program for scheduled security screening, so they can quite literally book a time to go through security and then just show up at that time and avoid the waiting in lines and being surrounded by lots of other people. And 6 of the airports have accessible or family lanes that offer more personalized assistance. And then the remaining 4 airports reported that they kind of had lower passenger traffic, but that they were able to accommodate special needs as necessary. It was also very nice to see that 8 of the 10 airports have dedicated quiet spaces for their passengers. Key informants mentioned their effectiveness, especially after stressful parts of the journey, like going through security. And it was also very pleasant to see that the 2 other airports are planning to add quiet spaces, and this further shows the commitment to improving the passenger experience. This commitment to inclusivity is clear through the partnerships with external organizations and ongoing facility improvements. Our final theme here is system-wide initiatives, and it includes services and programs across the airport environment. So we decided to include formal training, community engagement initiatives, wayfinding solutions, and data sharing. So in terms of formal accessibility training, it's necessary for effective airport services. And key informants pointed out that even though they have all these great accessibility services available, they only work as well as their airport staff's knowledge on how to support passengers with specific needs. Currently, all airport staff go through mandatory training through the Canadian Air Transportation Agency. And the informants mentioned that these trainings tend to be a little bit outdated, but they're very grateful because the Canadian Airport Council is working on providing an additional updated accessibility training program. And this aims to keep staff updated with the evolving accessibility standards for optimal passenger support. And 6 of the airports go well above and beyond the mandated training and provide personalized accessibility training specific to their airports, reflecting a proactive approach to inclusivity. Community engagement is actually a key strategy for improving services throughout the airport. And while some airports have already partnered with community organizations, others are super eager to collaborate. And engaging with airport partners, again, highlights the mutual dependence for success, despite some of the challenges that come from coordinating with external service providers like the airlines, the security agencies, or the businesses within the airport. And this kind of goes hand in hand with the advocacy and partnerships because they play a very important role in sharing information and raising awareness about the accessibility services. For example, the Sunflower Lanyard program is gaining popularity worldwide and is available at 5 of the airports currently. And the program's success has really encouraged interest in developing training and awareness programs for all passenger-facing roles, with the goal of enhancing safety, comfort, and awareness during interactions. I think we can all agree that navigating an airport presents challenges for all travelers, especially during those check-in, security, and post-security processes. And this becomes even more complex for individuals with dementia and their travel companions, who must process electronic information and interact with multiple staff members. And so the wayfinding experience is crucial for their comfort and confidence during travel. Airline partners do play a significant role in assisting with wayfinding. They can escort passengers through security to reduce wayfinding challenges. And airports of all sizes are actively trying to improve their navigation with different technologies, like using clear signage, user-friendly maps, and some airports even offer an autonomous wheelchair program called WIL. And one airport even discussed the development of a wayfinding guidebook for 2024. We've learned that data sharing does pose an issue. Airports face challenges in collecting detailed passenger information because of privacy limitations and system disconnects with the airlines. And because of this, airports are currently operating on pretty high-level passenger data, which really limits their ability to provide personalized services. And so to address this, most airports are prioritizing passenger data collection, whether that be through surveys or observations. They also involve various community groups, some even including those living with dementia, in the feedback processes to gather the information that they need. And they've also increased surveys in terminals since COVID. And they've even gone as far as conducting interviews with passengers to learn about emotional touch points throughout the journey. So I really think that this holistic approach ensures that airports are making informed decisions to enhance the overall passenger experience and the accessibility services. And based on our findings, there are some implications for both airports and people living with dementia. So for airports, remarkably, none of the initiatives were targeted towards passengers living with dementia, while recognizing there are potential overlapping needs among individuals with different disabilities. We do suggest that airports actively try to promote these initiatives to reach a broader audience. And while not every airport works with community groups for people living with dementia, many are showing interest. And to truly include everyone, it's very important to improve accreditation, accessibility, and partnerships with a wider range of disabilities. One effective way to understand the travel needs of those with dementia is to talk directly with them, as well as with the groups that advocate for their needs. Airports are moving towards a wider range of services for older adults beyond the basic accessibility requirements. Airports that understand the needs of older adults, especially those with dementia, want to do more than just the basics. They're working on special programs that go beyond that one-size-fits-all approach. And they also know that making these programs truly accessible is a big challenge, not just putting them on their airport websites. And then collaboration between airlines and airports is crucial for addressing data access challenges. Standardized protocols for secure data sharing are essential to facilitate information flow while protecting passenger privacy. Overcoming these challenges is vital for airports to improve passenger experiences by customizing services, optimizing their operations, and enhancing efficiency. Standardizing language across airports is also necessary for clear communication. And then for people living with dementia, before you start your journey, take the time to research and plan ahead. Look for airports and airlines that offer those personalized assistance to meet your needs. And this would include checking the accessibility information on their airport websites, contacting the airlines or airports directly for more information on their services, and arrive early to handle any unforeseen changes or challenges. Please share your unique needs with the airport and airline staff. This helps support you better, and it can also you can also use programs like the lanyard program to disclose your needs and to communicate them without having to share your diagnosis. Your feedback is really important for airports to understand the challenges faced by travelers living with dementia and to improve their services. Share your experiences with airports and airlines to help them improve, and consider joining community organizations that are working with airports, because this can also help make your travel easier. Your input can make travel more inclusive and supportive for travelers with dementia. And finally, use those airport services like the fast security lanes, quiet areas, curbside assistance, and meet and greet services, because they can greatly improve your travel experience. Even if you don't initially think that you need these services or that these services are for you, they are designed to cater to diverse needs and ensure a smoother journey from start to finish. In closing, all of our efforts aim to promote inclusivity and enhance the quality of life of this demographic. Here's how we can see continuing our efforts. We want to continue to engage with people living with dementia and their travel partners directly through surveys and interviews to understand their needs, challenges, and preferences when traveling. We're going to continue to engage with other countries to understand best practices and innovative approaches to improving accessibility in the travel industry. And we hope to expand this study to encompass other sectors within the air travel industry, like airlines, ground transportation, and travel agencies. We also want to share our findings with international organizations, universities, and stakeholders in various countries, so we can develop specific recommendations tailored to different sectors. We hope to provide guidance to people living with dementia and their travel partners on how to navigate the travel experience effectively, including resources, tools, and strategies for a smoother journey. And finally, as a research team, we plan on implementing pilot programs in the airports and with airlines while tracking the impact of these programs on accessibility and user experiences. And this includes, of course, gathering feedback from people living with dementia and their travel companions to make the necessary adjustments. This is only just the beginning, and I'm really grateful for the chance to connect with individuals like you and to share our research. Whether you have personal experiences with dementia or are interested in our research program, I invite you to contact me over email. Our focus is on enriching education and awareness about inclusive air travel and advocating for policy changes that align with the Accessible Canada Act's goal of achieving full accessibility by 2040. Thank you so much for tuning in.
Thank you so much, Ali, for this great presentation. And every time I hear it, I just think of, my mind keeps racing. But now over to the audience, and I do want to do a shout out to Val and Michael, who are also in the audience, I noticed. So maybe we can stop sharing, and maybe that would be a good idea, and then everybody can see everyone who wants to be seen, I guess. So are there any questions? Could you please raise your hand or write it in the Q&A? While people are mulling things over, maybe we can kind of think about, I was wondering about training, Ali. You know, there's a lot of training was one of the issues that came up as being, do you have any ideas or some of the challenges that some of the organizations might have in terms of training their personnel? I mean, a lot of people struggle with going through airports and security and so on. Do you have any thoughts on how people can do that?
In terms of training for the airport staff,
Yeah.
yeah. So I do know that through the interviews, one of the biggest challenges they experienced was just the vast number of employees they have at the airport. So they do their best to do these mandatory trainings for them. But to kind of fill in the gaps, what they've been doing is providing like lunch and learn sessions on specific topics related to accessibility. And although they're not mandatory, it does provide a few additional training resources for their employees just so they can better support the passengers that are traveling through the airport.
So in terms of employee support, we do have a question in the question around what can the travelers do to make airports safer and easier to navigate for persons living with dementia? And is there anything that can happen there in terms of awareness and so on?
In terms of the general public, I think it's so important to just educate yourself and be aware. Everyone, you don't know what people who's living with an invisible disability. So just having that patience and that awareness of the fact that there are people traveling through the airport who might have an invisible disability that you're not aware of. Participate in training sessions or educational seminars like this one, just to create awareness. And in my case, I would just suggest always offer support if someone looks like they might be confused, just to make the travel experience easier for everybody.
Do you think, you know, there's been conversations, like some people have been talked about, you know, how having a diagnosis, like, do you think that would be a good way? You know, if I got diagnosed as having dementia, should I come and then say, look, I have this diagnosis and here, you know, that would open the doors for me to make things easier? What do you think?
I don't think it's necessary. I think what's most important is disclosing your needs, just because a diagnosis of dementia might not fully tell the employees exactly what you need. And so in some instances, you are better off disclosing exactly what you need from them for them to be able to support you, especially in the instances where some people might not realize that they're living with dementia. And so in those cases, it's important to just let them know exactly what you need, and you don't have to go and disclose your specific diagnosis to them for that.
Okay. I see that you have several different kinds of methodologies, like ethnography, I think, which came from some of your colleagues. So before I go there, I do have a couple of more questions. So we'll go to the audience and I can come back to that. In your discussions with airport staff, did you get the impression that there's a genuine commitment to pursue enhancing current practices?
Absolutely. I mean, it goes as far as we spent more than 2 hours with some of the airports talking about our perspective on it, talking about their perspective on it, and all of them really did show a commitment to improve services specifically for travelers living with dementia. So it was quite enlightening. We had so much fun with the interviews, chatting with the airport informants.
So it sounds like, I guess, you know, probably all of us are thinking about our own experiences in airports and going, it's not easy for most of us, you know. So, and one of the things I think that people struggle with is asking for help. You know, we
Exactly.
don't want. So I think you brought this up when you said people don't want to identify necessarily as having a disability, and we know that came up. And Dan asks, you know, he says, "What are your suggestions to encourage?" You know, and he says, those quote unquote stubborn loved ones who just don't ask for help, you know, just go and ask and try and take advantage of this. Like, do you have any suggestions for how to get around that?
I think it requires patience, and it requires an understanding that Some people will ask for help when they're ready, and unfortunately sometimes that might fall in the moment. Like as I mentioned, sometimes it's when you're in the airport and you realize maybe how much help you might need, and so that might be the instance where they would end up seeking help. Sometimes it's not easy to plan ahead with those who may be stubborn about asking for help. But I think what's most important is just being supportive, and making sure that they're set up for success through the journey and the travel. So if you can support them on in any way without them having to ask for help, then like we recommended possible checklists for pre-planning, things like that can really assist with the process as well.
Right. And I think as our colleagues, Michael and Val have often talked about as well, that emotional spiral that one can go through when you don't really realize, you may think you don't need help, and then all of a sudden you're in the airport and oh my God, now all of a sudden you do need that help. And it's nice to know that those things exist beforehand. So pre-planning sounds like a great idea. Just trying to see if there's some more questions here. Yes, we do. Can you recommend resources to find specific tips for travel companions besides the service availables? For example, what are some of the potential triggers or trouble points and how to prepare?
Yes, actually, some of the groups we work with internationally. So there's a group in the United States. Correct me if I'm wrong, Linda, but I believe it's the University of Minnesota.
Yeah.
And so they actually work on providing resources and tools directly for people living with dementia and their travel companions. And they've also worked with Teepa Snow to develop some really great videos, where they're kind of role playing the air travel experience or the airport experiences. And it really provides some great tips and resources that you could refer to before your travel if you're looking into that.
Okay, and I know, and Michael, I was wondering if you could put up maybe the website, I think that we have, where we're trying to bring together some people across country as well. Ben was wondering about some of where you got your information about, the things that might be important to people with dementia against what was offered on the websites. And he was wondering whether or not, was that determined? How did you determine that those were important services to people living with dementia? And was that from the ethnography? Did you ask people with dementia? Where are you going with that?
So that really, I think, started coming from the consultation and stakeholder groups and workshops that we conducted. So that was kind of the very preliminary phase. And so we had advocates, different groups, and people with lived experience. So there was a care partner and a person living with dementia that were participating in it as well. And I think that's what really guided those important services. So we kind of used those insights to inform the selection of what services are deemed most relevant to people living with dementia. And then, of course, current literature and working with our groups internationally helped that as well.
Right. And also, Ben, just so you know, Val is continuing to work on the ethnography side of things and looking at what's happening with the conversations online with Michael and Ali. Part of your PhD, of course, is to go and do just that and verify what people with dementia prefer to use and so on. In terms of international travel, did airport employees indicate that the airlines now would offer assistance at arrivals, particularly for arrivals in countries where there would be a language barrier, or is this something that will be explored in future research?
Yeah, that's a great question. So what we learned from the interviews was that there is a very big disconnect between the airports and the airlines. So the airport informants couldn't provide insights on everything related to kind of the responsibilities of the airlines. So I don't know if I can really speak to that question, but we're hoping to connect with airlines in the next phases of our project. So hopefully we'll have an answer for you for that and some more depth to support that.
Yeah, and that answers, I think, the next question, which was around looking at design of planes and so on. There's lots of work. Like right now, you were just working on airports, but certainly that's an area. And I think that's one thing we discovered is there's so many different pieces in this whole air travel business.
Absolutely. It's a big system, and we're hoping to slowly learn from each area of the system just so we can kind of holistically improve the system for people living with dementia or invisible disabilities.
Mhm. And there's a couple of questions around exiting, leaving the airport, because we talked a lot about, in the presentation, talked a lot about arriving at the airport, and there's some questions around, is there an interest in looking at, what happens when you're arriving and you're leaving or you're exiting the airport?
Yeah, so the curbside assistance, it can also be applied when you're exiting the airport as well. So you can book that in advance in some instances, or when you arrive at the airport, if you're coming from a different destination, you can also book that service. And most of the airports offered accessible ground transportation. We didn't dive too far into that, but most of the services upon arrival are also available upon exiting the airport as well.
Okay. Okay, that's great. And I think there's a couple of links for the attendees for some of the web pages. There was a request for the University of Minnesota. So if we can't offer those right away, I know Michael's and Val are there. So if you can offer those, if not, we can make sure that we'll send them ahead of time, I'm assuming. So I think that's it for the questions. I don't know if there's anything else. Just trying to look if I'm missing some. Michaela, please let me know. I think one of the things that you spoke to, as well as the whole need for this international exited and leaving too, and arriving in other places, right?
Absolutely.
This is one of the things that's very important. I wondered if you, maybe just a couple, we have a few minutes about disclosure and the desire for people to actually disclose, and how the lanyard program might play into that.
I think the lanyard program really opens up the conversation about disclosure, especially for those living with invisible disabilities, because like I said, you don't always know if someone's living with an invisible disability. So it's a discreet way for someone to maybe notify. You don't need to know their condition, but you know that they might need some additional assistance. And we also learned that aside from the Sunflower Lanyard program, there were people living with dementia who actually created their own little name tags that said something along the lines of, "I'm living with dementia, please provide a little bit more patience during my travels," and things like that. So that's a great way to do it. And the Sunflower Lanyard program in some of the airports offered alternatives, like a sticker with the sunflower. So it's a little bit more discreet for those who may not want to wear a lanyard, or those with sensitivities to wearing a lanyard, or different things like that. So there's ways around it, and you can get creative. I think the lanyard program opens up the door, but disclosure is really up to you. It's up to you how you want to disclose and what you want to disclose. So just make sure that you realize you don't have to give more information than you're comfortable.
So I think, I want to thank you for the presentation. I think you sound very hopeful. And I think a lot of people who think about, don't necessarily see dementia and air travel as two topics that come together.
Yeah.
So, are you hopeful? Because you sound like you are. So should
I'm
we
very
all
hopeful.
give up and not travel, or do you think there's
I'm really hopeful. And I think the interviews with the airports really made me realize that this is an important topic, and people are willing to change and improve services to cater to people living with dementia and invisible disabilities. And I'm really looking forward to learning more about it. And I always say, if an airport is dementia inclusive, it's inclusive for everyone. So it'll improve everyone's experiences in the airport, which I think is the most important part.
Okay, maybe I'll just sneak in one more question, because I know Pearlie is interested in technology and things like that as well. Do you think there's a role for technology in facilitating some of these things?
Absolutely. I'm glad you asked that, Linda. Um, uh, One of the things that we're looking at actually for my thesis is using citizen science. And so this would be using a mobile app that's developed for and with people living with dementia. And it allows them to, let's say, assess the airport environment and provide real-time feedback. And this alone, I think, would be really beneficial because, like I mentioned, airports are currently really just collecting high-level information. And so having these technologies and different resources can not only help the airports for customizing their services, but it also helps people living with dementia being able to provide that feedback to improve the services for themselves.
It's awesome. That's good. So, well, thanks again. I
Thank
think we're at
you.
56 here. I have 12:56 as my time here. So we're finishing just under the hour, giving people a bit of a little break before their next meeting. So thank you everyone for attending this webinar. Thank you, Pearly Health. And let's keep traveling, everyone.
Yes, let's do it. Thank you.